This has been a particularly exciting ESMO 23 for endometrial cancer. We've had 3 first-line trials, either presenting or providing updates. The first one was the AtTEnd trial, in which we learned that the Immuno-Oncology agent Atezolizumab, a PD-L1 inhibitor, also provides efficacy in combination with chemotherapy in the first line, and particularly in the dMMR population, so the MMR deficient cases. GY018, which has presented previously, updated, and in that trial they were powered to see the MMR proficient outcomes, and so it was pleasing to see that those were still statistically significant, important for those patients, as well as the dMMR group doing particularly well. In that trial, they also looked at methylated cases, and there's been this question about whether MLH1 methylated endometrial cancers would not perform as well in response to immuno-oncology therapy as do the MMR gene mutated cases. But in this trial, they were equally benefiting from the immuno-oncology treatment in combination with chemotherapy in the first line. And perhaps the concern for the methylated cases has arisen from the second line setting, and we need to understand that biological difference better. And then finally, the Ruby trial provided an update. And the reason that was important was because they updated across the 4 molecular subtypes of endometrial cancer. We've not seen that before. So that means that clearly the dMMR group did very well, but within the pMMR group, the p53 mutated subgroup also did surprisingly well. That's an aggressive subgroup with a great unmet need, and that information will lead us to plan differently our future studies for that group. We also had the DUO-E study report, in which a PARP inhibitor, olaparib, was added to the backbone of chemo immunotherapy agent in the first line for endometrial cancer. And in the dMMR setting, that perhaps not surprisingly didn't appear to be a benefit. There's unlikely to be DNA repair defective cases in that subgroup. But in the pMMR, so MMR proficient subgroup, an advantage was seen for the addition of the PARP inhibitor. There are a number of questions still remaining though, because how to identify DNA repair defective or HR defective cases in endometrial cancer has not been well defined yet, and in fact was not reported. So we have no idea who those patients were who were responding really. And there was the single PARP inhibitor arm lacking in that trial. Finally, I just want to comment briefly about DESTINY. So DESTINY is looking at the exciting class of antibody-drug conjugates, and in particular T-DXd, which is HER2-directed. And although numbers were small, the outcomes were extremely exciting for endometrial HER2-positive cancer, which again is a very aggressive subtype with an unmet need. So really a lot to take home about endometrial cancer from this conference.